Appendicitis without surgery? There's a new JAMA article that just came out January 2026, and we need to talk about it. What's up, you guys? It's your ER pharmacist, Lil Pharma. Today we're talking about the new JAMA article just dropped January 21st, 2026. That is a 10-year follow-up of a previous trial, the longest data we have comparing antibiotics versus appendectomy for CT-confirmed acute appendicitis. Here's the punchline. 61% of patients who had acute appendicitis avoided surgery and were treated with antibiotics even at the 10-year mark. And that number didn't drop after 5 years. So from a pharmacist standpoint, I'm wondering what regimen they used. They did use very broad antibiotics. So they started out with ertapenem for 3 days. So IV ertapenem once a day for 3 days. And then they transitioned them to oral levofloxacin and metronidazole for a total of 10 days. So again, that's very broad coverage. It's going to hit a lot of gram negatives and anaerobes. Once a day ertapenem dosing is easy for outpatient infusions, and then of course transitioning to oral, it makes it easy to send them home from the hospital. Other evidence-based options would be ceftriaxone and metronidazole, a fluoroquinolone plus metronidazole, remembering that something like Unison or Augmentin are not recommended for appendicitis because of high rates of E. coli resistance. So even for the patients who did undergo an appendectomy, delaying surgery wasn't actually harmful. So their adverse reactions, they didn't see increased rates of C. diff or any other major complications compared to the people who got earlier surgery. Major complications were actually much lower with the antibiotic group. Not surprisingly, I'd rather take an oral antibiotic than go under anesthesia and get my appendix taken out. This isn't going to work for every single patient. There was a significant chunk, about 15%, that did fail early and had to undergo an appendectomy within the first 72 hours. But again, this was still considered safe. So this doesn't mean it's going to work for every single patient, but interesting to know that this can work for some patients, and it's worth a try because even if patients fail, there really wasn't a huge risk of major complications. All right, that's your literature update for the day. Bye!